Doctors, when did a patient's lie nearly end up killing them? Middle-aged housewife comes to ED with episodes of headache and collapse, vacant episodes. Usually early hours of the morning. Has the full workup with CT scans and lumbar punctures several times, always negative. It took several attendances before anyone asked her about recreational drugs. She was an unassuming suburban mum. Turns out she was into cocaine in a big way, leading to reversible cerebral vasoconstriction. Not a doctor, but I was in the ER once, separated from another patient by only a thin curtain. It was impossible to not overhear what was going on. She was an elderly woman who had taken an ambulance and due to feeling faint and said she had no other symptoms. Hours are going by. She gets up to use the washroom a couple times and makes small talk with her brother. Sounding pretty woozy the whole time. Doctors keep checking on her. They draw blood and check her blood pressure. I think it was like remarkably low, but they aren't sure why. Cut to several hours later when a nurse notices there's some blood on the woman's bed. After some back and forth, she finally admits that she had been bleeding profusely from her rectum for weeks. Paramedic here. One common one is when older guys are having chest pain and we want to give them nitroglycerine paste pills to help the chest pain. One thing that doesn't mix well is nitro and Viagra. It causes a blood pressure drop that can be really dangerous. We always ask and make it really clear that if we give the nitro and they are taking Viagra and similar meds that they could die. It usually takes 3 or 4 warnings in a row before the guy will admit it. Early on I made the mistake of trusting a guy after just a couple mentions of how dangerous it would be. I sprayed the nitro under his tongue and he said, "Does generic Viagra count?" FCK. At one point his BP wasn't even registering on the box cuff. It was bad. I thought I was going to get screamed at by my doctor. But he just laughed and said it was so common that he wasn't upset. And gave me a couple ideas on how to make it clear how dangerous it was to the patient. I work in outpatient surgical center. Lying to anesthesia can be really dangerous. I've had a person lie about not taking drugs and then react badly when given the anesthesia meds because they interacted. Fortunately for that patient, not nearly dying, but I will forever have it ingrained in my head, the anesthetist leaning over their head screaming, "What drugs did you take?" Full stop. And after that I fortunately haven't seen serious event, but definitely has happened to our providers, and I've seen more mild versions. People eating, drinking before the anesthesia and then denying. Lucky for my patients they just have puked after waking up, so we know they had it but made it okay. The danger is you can puke during sedation and then get it in your lungs, called aspirating, and die from that. Could be really bad, but fortunately I personally haven't seen the worst yet. Not a doctor, but my sister's godfather was diabetic. He went to the ER because he had a really bad cold for like 2 weeks. He went in and they asked him if he was a diabetic, and for some reason he said no. Long story short, they gave him something that made his sugar levels go up and he went into a coma. He died about a month later because his organs shut down. Edit. He was only 32 years old, just in case anyone was wondering. When patients lie and say they haven't eaten anything prior to elective surgery when they have. I caught a patient snaffling biscuits that her partner had brought in for her because we are so cruel to deny her food. People can die from aspirating stomach contents during a GA. One of my relatives had a bad reaction to amoxicillin as a child. Puffy face. Trouble breathing. Emergency room visit bad. Fast forward 15 years. She's off at college and has come down with some sort of infection. She, however, didn't inform the campus health people. Because, and I quote, "Allergies are caused by a bad diet. And since I'm a vegetarian I shouldn't have them anymore." Yeah. They prescribed her amoxicillin. And if it weren't for her roommate being home to call an ambulance, she'd have been dead. I wasn't the lead on this case. But I was the assist. When I was in dental school, this patient came in and was really hyped up. My buddy asked him if he has been on any drugs and the guy just said he had a lot of caffeine. Okay, we moved forward. From what my friend told me, his blood pressure was high. But not too high for an elective procedure. Part of the local numbing we give patients has epinephrine in it, and sometimes this gets into the bloodstream with certain types of nerve blocks. Not uncommon. However, if you've snorted a couple lines of cocaine and then get EP in your bloodstream, that's no bueno. Ended up calling the ambulance. His BP was so high he was at risk for a stroke. So yeah. Even stuff the dentist does can kill you if you lie. Here's a FK'd up family story. We had an 81-year-old frail grandmother brought in by family for failure to thrive in the setting of incurable stage IV colon cancer being cared for at home. Patient was admitted awake and conversational. Poor historian. Complaining of pain. She proceeded to gradually get sicker. Shut down like she was dying, becoming gradually nonverbal, unresponsive, and dropping vitals. She was DNR, so we did supportive care and looked for causes such as UTI, SBP, sepsis, liver failure, etc. The family was around the whole time, acting very involved and caring. 36 hours later she gradually started coming out of it, before recovering back to baseline. It turns out she was given her home dose of morphine in the ER prior to admission, which was 100 mg extended release morphine, twice daily, as she had been complaining of pain. Her family had failed to mention that they'd been diverting all her pain medications. That nearly got their grandmother killed, as we had no reason to suspect an opiate as the cause. That reminded me to always consider opiates. We discharged her to a long-term care facility. Not a doctor but an army combat medic. We were in a small firefight and another soldier was hit in the leg. It was very easy to see the wound because of the desert camo doesn't blend in well with blood. The part that almost killed him is he never told us that he was hit in the chest. We asked him and he said only in the leg. I knew he was lying because he was holding his chest too. But I didn't want to make a bad situation even worse, so I didn't say anything. But when we asked him again and he said no, I didn't want him to die of course, so I pulled his plate carrier off and we did more medical on him. He definitely would have died from that wound. It punctured his lung and he was having trouble breathing. We called for a medevac and he lived but with only one lung. I work in an STD clinic, so the stuff I deal with isn't usually deadly, or at least not immediately deadly. However, I am constantly surprised by the percentage of patients who test positive and refuse to tell their partners. A guy came in a few years ago who for something relatively simple like gonorrhea, but seemed to have trouble walking. Long story short, a nurse called an ambulance for him and sent him to the ER for a spinal tap. Turns out an ex-boyfriend refused to tell him about his syphilis diagnosis after they had a rough breakup like 15-20 years earlier. So not only was our guy possibly spreading syphilis unknowingly, he now had untreatable neurosyphilis. He worked with our disease intervention specialists to track down as many partners as they could, but I think he died from related complications like a year after his initial visit. We had a patient that took her home heart meds religiously even in the hospital when we were also administering them to her. She was educated to not take any of her home meds while she is hospitalized since we're giving her the hospital meds. She would sneak and take them. Her blood pressure bottomed out and would have to bolus her. Security was called and had to remove the meds from her and lock them up. We had another patient requested a sleep med. The nurse gave it to her. Later, found patient barely arousable and blood pressure dropped, which did not make sense. She was given a low dose of sleep aid. Patient had her purse open on the bed and found a prescription of Ambien. The patient took our sleep aid plus double dose of her home med Ambien. We always instruct patients on admission not to take their home meds while in the hospital. We are not allowed to go through their belongings due to privacy. Edit. My step-uncle, brother of my stepfather. Never met him though, lied about being in pain sick so he could stay home from school and miss a test. Kept upping the ante so they'd believe him. Apparently his parents were pretty strict and he was terrified to admit he'd lied. Long story short, they took him to the hospital. He was diagnosed with appendicitis, and they straight up cut him open. The test was looking pretty good at that point. Had a grandma who was basically comatose status in ER. Whenever we could rouse her or get a word, she stated she wasn't on any drugs. We YOLO gave her Narcan, narcotic odd drug, with no effect. 20-30 minutes later we do flumazenol romazicon, benzo odd drug, and she wakes up. A lot of PPL weren't suspecting her of drug OD given her age and statement, so they were thinking 900 different routes. My cousin is an ER doctor and sees this quite a bit. Mostly people lying about having done drugs and underage drinking because they don't want to get in trouble. Not understanding that the doctors are less concerned with that than they are making sure the person lives. One particular incident, the person had drunk quite a bit and done several kinds of drugs but wouldn't admit to it. And came in alone, so there was no one to verify what had happened. Because this person wouldn't admit to the drugs they'd taken, and thus wouldn't tell the docs what they had taken, they had no way to help and could do little except watch as this person slowly died from the drug and alcohol interactions, because without knowing what was already in their system, giving them anything could have only sped up the process. The person was a minor and passed away from massive organ failure because they were more worried about getting in trouble than saving their own life until it was far too late to admit the truth. Vet here, so in my case it is the owner telling the lie that can kill the patient. It is hard to get the point across to people that I am not going to call the cops if you tell me your dog ate your drug stash. Just telling me will save time. Lots of money spent on diagnostics. And possibly your pet's life. I really don't care if you do drugs. The only scenarios I can think of where I would call the authorities would have to involve deliberately harming an animal or extreme neglect that I know will continue in the future. Not a doctor. But my dad's a paramedic. He's told me plenty of times about when patients have told him they've taken Ziz drugs when they've been doing illegal drugs to avoid getting into trouble. And he's administered drugs which just make it 10x worse because of the combination of them. And he can't do anything else other than just take them to the hospital if they're still breathing. Nurse on an ortho unit. This particular patient was a fresh post-op joint replacement. They woke up in the middle of the night going batshit crazy. He was insisting he had to leave. He was seeing things. We were on the 6th floor and he tried going down the back stairwell. There was no reasoning with this dude. He was straight up determined to leave. Turns out he was detoxing from alcohol. He had lied to both his doctor and the nurse that admitted him about his alcohol use. When you're a heavy user like he was, quitting cold turkey can kill you. We were lucky he didn't start seizing before we got meds on board to help him detox safely. I was very thankful I caught him trying to get down the stairs before he went ass over tea kettle and cracked his head open. A few months later, he was back on the surgery schedule to fix an injury on his operative leg from falling. Luckily, his doc knew to plan for detox this time around. But the patient also planned ahead. After he was discharged, we found a bottle of booze in the bedside table. The most frequent one is that they don't need a specific antibiotic or other life-saving drug because it is really just too expensive for them to afford. The fault is mostly with the drug companies. They find out they are the only ones making a specific drug and they raise the price just because they can. Then the insurance stops covering it and the doctors may not learn any of this until the pharmacies start calling his office to get the drug changed to something else. But there is no telling how many people die or suffer serious health problems because of the drug and insurance companies' greed. A lot of people get less than ideal treatment simply because of these middlemen trying to get their cut. It may please you to know that in Canada, the government regulates how much a company can charge for medication. As a result, medicine prices are just 10% of what you would pay in the US. And in some cases just 1%. It is amazing what happens when the government is for the people instead of the corporations. I'm an NP in a medical IQ. Probably my most consistent is people lying about their drinking habits. I could give less than a tea if you pound a bottle a night. I just need to know so I can be ready for you to start detoxing on day 3 and have the right meds in queue so you don't have a seizure, aspirate, etc. I always make this abundantly clear. And I am not the morality police. Yet. Every year we have a few come in with very fixable problems. Lie about heavy drinking habits. And ultimately die in the hospital from complications secondary to their withdrawal. My teenage brother had the opposite to most of these stories. He came home after being out drinking with friends, raided the fridge and went to bed. A little later he comes out panicking to my parents that he's having trouble breathing, is feeling dizzy, and has a bunch of other alarming symptoms. They rush him to the ER and from what they tell me the staff were yelling at him to tell them what drugs he'd taken, even though he was adamant he hadn't taken anything. They wouldn't believe him. My parents were begging him to tell them, but he insisted he hadn't. I'm not sure of the rest of the details, but it turns out he had developed a nut allergy he wasn't aware of. Social worker at a children's hospital. We have kids coming in through our resuscitation room that have been seizing and are unconscious with no prior history. I'm constantly trying to get parents to tell me if there is a possibility that their toddler might have ingested something. Does your kid have access to cannabis? Could they have eaten some? Full stop. Parents never want to admit it to doctors, and so I'm always on a fact-finding mission. As a social worker, parents are either glad I'm there or they think I'm going to take their kids away. Cannabis can affect children in horrible, shut down your ability to breathe kind of ways. Insert any House episode. Cue 30 minutes of wrong diagnosis that nearly kill the patient until House has an epiphany. Busts into the patient's room violating some order or another from Cuddy and says, "Did you get a new DVD or Blu-ray player recently?" "Yeah." "Why?" "You inserted a TV episode of a formulaic but witty medical drama, didn't you?" "What?" "Don't lie to me." "Where did you stick it?" "In my butt." "Nurse, prep this man for surgery." "I'm a woman." "And you chose your butt?" "Okay." The patient is saved. Etc. Etc. Had a relative that went in for surgery on his stomach. There were holes in the lining that were caused by painkiller abuse. No one at the time knew what was causing this except for my relative. Doc asks him if he was on any medications. Relative says no. They put him under. He didn't wake up. His toxicology showed oxycodone and hydrocodone. Don't lie to doctors. They don't tell anyone about your medical problems anyways. I'm not a doctor but a patient with a couple of really weird disorders that cause doctors who aren't familiar with them to think I am taking. I have been denied very needed basic treatment like a bag of saline because my dehydration is exasperating my symptoms because they think I'm somehow gaming the system. These assumptions that patients are lying do a lot of harm. 2. How about the opposite? I've moved a lot and when I visit a new doctor they often try to answer my health history for me. Drinking? Smoking? Exercise and diet? Then, you're thin. So moderate. No. Regular. Healthy. Apostrophe. None of that is accurate. But when I correct them I get ire. So is this a cry for help? Apostrophe. What? No. I just want you to have the facts.